Hi, I'm Rose. I work in policy and research at the Money and Mental Health Policy Institute. So we're a relatively new charity. We were set up in spring last year by Martin Lewis, the founder of Money Saving Expert. And we were set up to look at the relationship between mental health problems and financial difficulty, and to develop really practical solutions to break that link, most importantly. So we've been doing work across the retail sector, the NHS and financial services to think about how can we make it better. We know that there's a really strong link between mental health problems and financial difficulty. So a quarter of people with mental health problems are in problem debt. That makes it harder for them to recover from their mental health problem. And when we started, we wanted to do a lot of research into actually what does that look like. So we did a big survey of 5,500 people with lived experience of mental health problems and asked them about their finances. It was the biggest survey of its kind. And 93% of people said they spent more when they were unwell. 92% found it harder to make financial decisions. 74% put off paying bills, and 59% took out a loan that they otherwise wouldn't have done. And I think there's some really quite surprising statistics. It's not often in surveys you get a stat like 93%. That's, it's actually really high. And so we've been looking at, why is that? What are the impacts of having a mental health problem that mean that it's harder to manage your money? And we've done a big piece of work called Seeing Through the Fog, which is a report looking at the various cognitive and psychological impacts. And so we've mapped it out on a condition-by-condition basis. So it might be if you have depression, you completely disengage from your finances, you find it hard to keep track. It might be if you have bipolar, you struggle to manage your spending and you engage in crisis spending, which is actually a diagnostic of the condition. It might be that you have anxiety and you can't answer the phone or you can't open the post. And it's worth saying that mental health is really individual, so everyone will experience these impacts differently. But I think the stats are compelling enough that actually it has a real impact on how people manage their finances. And so we've really been looking at what can we do to break the link. And as looking at what the various impacts are, we've looked at what might the adaptations be in a financial services context. So if you're struggling to keep track of your bills, actually an account that jam jars your money for you and always make sure that those recurring payments are covered, that your rent is covered, could be really helpful. If you're struggling to engage, visualization of your spending data could really help. If you're struggling to control your spending, actually being able to put restrictions in place would be really valuable. And they are just restrictions, especially, are things that just don't really exist in retail accounts at the moment. So that could be going from putting a spending limit to actually saying, I don't want to be able to spend on certain merchant categories. It could be gambling, or it could be shopping, or certain websites that that you find particularly hard to resist. Or also being able to say, I don't want to be able to use my card at night because I know that I really struggle with late night shopping, which is something that lots of people have told us about. And really thinking about what are those adaptations that financial services could put in place. And I think it's worth saying that tech isn't the only solution, but actually for a lot of those it struck us that technology could really help. And in some of those spaces, fintech firms are actually already doing some of that stuff, but it's not actually been widely adopted by the financial services industry. So we're looking at how tech could help, in part, as one of our work streams. And we did a tech sprint a few weeks ago with the Financial Conduct Authority, which got together lots of financial services firms, but also mental health experts, different kind of tech companies, so gamification companies, some companies that specialise in mental health tech, and got them together and thought, what are the solutions that we could put in place to tackle the common problems that people with mental health problems face. And what was really exciting about that event was, by the end of it, a lot of the solutions that we've been talking about seemed really boring. It was like, another tool that lets you set spending limits, another tool that lets you have, simple third-party access to your account, a tool that allows you to send a notification to a trusted friend, when actually lots of those things don't exist. And so I think it was really exciting to get that conversation going, but we're just really keen that people actually take it forward and start thinking about how can you design financial technology with people with mental health problems in mind. and develop solutions that would work for them. Because I think at the moment the system obviously isn't working well at all. And I think it's worth touching on definition of fintech, seeing as that has been a theme. So I think when we're talking about fintech, we're talking about both tools that can help people manage their money better, but also in the broadest sense of the phrase, thinking about how financial technology can also help the inner parts of bank systems and financial services firms. So I think a really good example of that is the use of AI and machine learning. Actually, that's used to predict fraud patterns. You could really use that to look at consumer spending behaviour, to help people, to give them really timely notifications of when their spending behaviour has changed, to give them option to say, if your spending behaviour changed in that way, do you want us to let a friend know so that they can give you greater support? And so really thinking about how technology could be used across the piece. And then finally, I think it's just worth saying that a lot of the solutions we're talking about are designed to empower people to manage their finances. It's not designed to be paternalistic responses at all. These are settings that you could put in place during a period of good mental health, or and settings that are designed to give you choice and control over your financial services environment. And I think it really is going with the trend of going towards personalised financial services. So thinking about what tools and settings people might need, and they're going to be very different. And actually a lot of the tools and settings that we're talking about would be really helpful for people without mental health problems. So lots of them I think, yeah, that'd be great, I'd love that, that'd be really useful to help me manage my spending. But they could have broader use cases, so perhaps for older people who are really anxious about fraud, being able to restrict your card in certain ways, because you know you only go to 10 different shops, would actually provide you with quite a lot of reassurance. And so I think it's just part of our narrative that although these would really help people with mental health problems, there is actually a broader use case for consumers too. And in addition to that, I think it's quite important that a lot of these solutions we've developed in conjunction with people with mental health problems. So this isn't us just sitting in a box thinking what would be helpful. We've actually got a really big research community of thousands of people with lived experience who we send surveys to. We ask them whether they would find these tools helpful. And actually a lot of our ideas are developed from people's lived experience and the fact that they don't feel that at the moment they have the tools to help them manage their finances effectively. So I think that's everything. Looking forward to the panel discussion later. And I guess just to reiterate that actually financial health is so important. It can impact our mental health, but also thinking about how our mental health can impact our finances.